Good afternoon. I'm Monica Hendrickson, the Public Health Administrator for the Peoria City County Health Department, and welcome to our Tri-County COVID update for March 25th. For the Tri-County region of Peoria, Tazewell, and Woodford counties, we now sit at confirmed and probable positive cases at 36,133. That's an increase of 798 cases from the previous week. One of the most drastic changes we saw was the addition of 520 cases in Peoria County, bringing our case count to 18,054. Tazewell County is now at 14,121, and Woodford County is at 3,958. Overall, our deaths to date are 595, reporting 3 additional deaths since the past week, including 1 additional death today reported from Tazewell County Health Department, a male in his 70s. I want to highlight that while 96% of our cases are considered recovered and 2% are at home and isolating, that Peoria County really did see an increase in cases over the past 2 weeks. Looking into the data, our team found a couple of trends that I wanted just to highlight. First and foremost, 40% of the cases in the past 2 weeks are attributed to individuals 10 to 29. In fact, the total number of cases since the beginning of March has been 276 for those individuals ages 0 to 19. Based on contact tracing, we found that many of these cases are attributed to school sports team activities, as well as St. Patrick's Day exposures. That does bring then our 7-day rolling average of the Tri-County up to 114 new cases daily compared to 82, which we had last week. Likewise, we're seeing what happens when you see increases in cases that then translates to increases in our hospitalizations as well. So for the Tri-County, the hospital systems of OSF, St. Francis Medical Center, Unity Point Health, which includes Methodist, Proctor, and Pekin, currently have 12 ICU beds in use and 30 non-ICU beds in use. This actually increases in the 7-day average for ICU beds from 8 in the previous week to 10, and from non-ICU beds 20 to 24. Looking at this data, some of the things that we want to acknowledge is the fact that while we're seeing an increase in the number of cases, this also contributes to the fact that what we talked about, that while there is a lot of positive things moving forward, we do not want to get complacent. And in fact, things such as adherence to vaccination is one of the best tools that we have. And next week, it opens up even further. And the reason why we can say that is because in the same time period that we saw that high increase in the younger population, we also saw only 8% of cases attributed to those 60 and older, which are we have high vaccination rates among that population. So vaccines work, and when you do become eligible, we hope you take advantage of that. I think a lot of questions that we do have and why we want to kind of focus on the fact that you do not want to get complacent is because, as the governor mentioned, and as you can see, we are really trying to move into that bridge phase. That bridge phase looks at 6 different indicators: vaccination among 65 and older, ICU capacity, new hospital admissions, daily mortality, overall hospitalizations, and a daily case count. And in some of these areas, we are trending well, and others we're actually trending backwards. And so again, it's going to take the full state and takes everyone's responsibility. So again, while there is that light at the end of the tunnel, there is no need to have complacency at this point in time. And we really want to make sure that we are able to move forward rather than stay in the current phase any longer. To talk more about kind of the impacts of this and some more of that type of messaging and what the opening means, I'd like to welcome Joshua Gunn, who is the CEO of the Peoria Area Chamber of Commerce, as well as the CEO Council.
Thank you, Monica, and good afternoon, everyone. As she mentioned, I'm Joshua Gunn, President and CEO of the Peoria Chamber and CEO Council. We are proud to be the organization that represents the business community here in the Peoria area. Just like everyone, over the past 13 or so months, the business community has faced unprecedented challenges. Some people say that word is overused, but it's the best way to describe what we're dealing with. Our economy has never quite seen anything like this. And while it feels like, and there certainly is light at the end of the tunnel, businesses are opening up. Our restaurant members in particular have faced a lot of challenges, and they're telling us that crowds are picking up and business is getting better. But in order for that light at the end of the tunnel to result in a real return to our normal or return to an even better economy, I'm here to encourage everyone to remain vigilant. At the Chamber, we are tasked with advocating for what's best for business, creating an environment in Peoria that is great for business. And I honestly believe the best thing that we can do for our business community right now is to follow protocols, is to remain safe, is to continue to socially distance, continue to wear masks, continue to monitor your capacity at your restaurants and your local retailers and your larger shops, and even in your office environments, as well as at things like Monica mentioned, our sporting events with our children. We're not through the pandemic yet. I know it's been long and daunting, and we all want to get through it, but we're not quite there yet. And if we really want to see the end of this thing, we all have to continue to do our part. I'm encouraged by the rollout of vaccines. Credit to the Peoria County Health Department, credit to our healthcare workers and our healthcare industry here in the Peoria region. We are really a national model for rolling out the vaccines. And one of the most encouraging things in the business community is that restaurant workers and restaurant staff and owners are soon to be eligible for vaccines. I encourage all of you to get it. I received mine this week, and it was a smooth process, really, really easy. And I'm feeling great about protecting myself and others from this devastating COVID-19 virus. But we just want to encourage all of our business members to remain safe and stay vigilant in the face of this pandemic so that we can actually get through it. I know there's a light at the end of the tunnel, but we still have a ways to go. Please remain vigilant, stay safe, and follow the guidelines of the CDC and our local health department. Thank you.
Thank you, Joshua. We'll open up to questions.
So that spike in the younger population, that's not classroom learning, that's specifically going back to athletics?
Yes, the spike that we're seeing in a majority of those cases from the 10 to 19 population is based on activities such as high-risk sports. I do not have that data point in terms of how many of our student athletes were specifically in the group of 10 to 19.
Castle County is saying that they're going to get some J&J vaccine and they're starting to take appointments for that. How is Peoria County going on that?
So we too received notification that next week we will be receiving Johnson & Johnson vaccine. The allocation is not large enough for us to do necessarily like a mass clinic or maybe set it up at our Headington Oaks location. We have enough that it really bodes well for us to do what's known as a strike team approach to really use that for some targeted populations. Because it's a one-dose vaccine, one of the key populations that we're looking to get this Johnson & Johnson is going to be our transient populations because, again, when we are able to interact with them, we want to be able to provide them immediate protection with that vaccine and not necessarily have to find a way to find them after 21 or 28 days later.
Do you have specific events?
We are working with the Home for All, the continuum of care, as well as AMT to assist in planning out the events for those sheltered and non-sheltered populations.
We mentioned Tazewell, and Peoria, is Woodward also receiving J&J vaccine?
I believe so.
And then going back to the issue of the bridge phase, you said in some areas are trending in the right direction, others are going backwards. Can you specify which are looking good, which are looking bad in this situation?
So I want to first highlight the fact that for us as a community to move into the bridge phase and even subsequently to phase 5, it is a full state. This is not currently a regional plan. So with that in mind, as a state, we look very strong in our 65 and older population getting vaccinated. ICU being over 20%, that also maintains really strong. Our daily mortality has been decreasing, and again, that makes sense. We've been highlighting and trying to get vaccine to our high-risk populations. Daily cases is pretty much trending just stable, but what we have started seeing is new hospital admissions, and that is something that we really do want to monitor and watch.
If Peoria's, let's say, hospital admissions, let's obviously it's a statewide figure, you said, is Peoria performing poorly in any of these categories? Obviously it's separate from the state.
Yeah, so I think overall what we are watching here as a county is definitely our daily case counts, because we saw that surge, and we hope that mitigation as well as the quarantine process can take that and get that under control. And then again, seeing that uptake in terms of our ICU and hospitalizations is something that we want to monitor. Now, I know the question that's going to happen, and we're all waiting for that too, is eventually we do have to get to an understanding of how we are going to be coexisting with COVID, both from a hospital and healthcare standpoint as well as public health standpoint. And that research is still pending. And we do hope that the state as well as nationally we see those type of measurements and guidelines come through in the next months.
I wanted to circle back on something we touched upon last week, which was the variants. The DPH website actually doesn't break that down by county. It's going to have like a lump sum of this many of the variants been found in the state, this many, of this one. So I had to do some research and some calling around to break that down for where it is in the Tri-County. And we do have cases in Peoria and Tazewell that are those variants. What I was wondering is, can you tell me what variants they are and like when you knew they first popped up or appeared?
I can't go to the full detail of when we knew they appeared, because again, these are individuals that, based on either travel history or from just a sampling surveillance-wise, were identified. But they are small enough that we consider them identifiable data points, so we're not going to be going into any further detail than that. But I will get back to you on which variants they are. I believe they are the Brazilian variants.
So was that believed to be travel-related or community spread?
I can't go into the detail. Again, it's small enough of a value that's considered identifiable.
I noticed on Facebook that you guys were trying to recruit nurses to help with a big vaccination event. What are you guys planning, and is this because you're expecting to get more J&J in the future?
So we are always looking for volunteers, as dispensers as we term them, because it's not just an RN that necessarily can vaccinate, but we do have openings for, dentistry is one that can also vaccinate. We're actually gearing up for the fact that we're still in this process. We actually hit at the Headington Oak site, we hit our 15,000th first dose given, and by the end of this week, we will actually have given our 10,000th, I'm saying that right, second dose, meaning that just on that site alone, we've provided 10,000 people both doses of vaccine. And it's started at the last week of December. And so part of it is that we are looking for more volunteers to help with fatigue. I mean, our staff has been the primary working groups of this, as well as our volunteer base, our colleges of nursing. And so a lot of this is just making sure that we're able to give people breaks, because as we said with the contact tracing, public health always knew that our type of emergency responses aren't kind of weather related, where they're quick one and done events. These are long responses, and we want to make sure that we're able to give the opportunity to give some relief to our staff as well.
So that wasn't necessarily for planning some big vaccination event?
No.
In the near future?
No.
Okay.
So just a general question, should people assume the variants are circulating in our community at this point?
Yes, I think in terms of the variants, I think you should assume that the variants are circulating. And that goes back to why you really don't want to have complacency at this point in time. The more we adhere to the masking and the social distancing and getting tested, because remember, testing is still very, very key to identifying cases, and those testing sites are still in operation, we're trying to get ahead of it, because every time the vaccine transmits from one person to another, there is the opportunity for it to mutate and change. And we want to make that harder and harder so that we can get ahead of this, so that our vaccines efficacy stays at the levels they are at, and that, you know, our hospital systems are within their capacity. And so again, vaccinations are great. I mean, I'm very excited about the numbers that we're seeing in our community, but it cannot be done alone. And to feel the effects of it faster so that restaurants and businesses can open faster means that you have to vaccinate and still do the other hard steps as well.
Last week you said the Tri-County is receiving 8,000 doses per week for allocation. Is that number still 8,000? Has it changed over the last week?
So March 29th was when we expected to see a small dip because we would be getting our second dose increases. Based on what was allocated projected last week for us, we actually saw an additional 2,000 doses. So right now, even with that dip, we're sitting about between 6,000 and 7,000 doses. So doing a little bit better than we expected.
How concerned is your office with the football games and close contact sports still going on? And have you talked to the schools or ADs about that?
We have spoken to the schools. We actually communicate with the superintendents almost on a weekly basis, and our staff works closely with the school districts. I think overall our concern is, again, that these are high-risk sports, and they are high-risk sports for a reason. And so while we understand the concerns that people are having, for us to come back and really get a control of it, we do have, you know, different parameters that maybe, you know, we had to communicate well with families to understand that, you know, lots of times our students think that after 10 days of being in quarantine without any symptoms that they can return directly to a sport. And that's not the case. The guidelines around quarantine still require that you have those 4 additional days before you return to any type of activity. So it's actually 14 days in total. So again, a lot of education with parents to recognize that when you go back into a high-risk sport or a high-risk activity, there are a lot of challenges that you have to understand and a lot of concerns that need to be addressed.
Monica, it's been a good 2 weeks since the CDC loosened requirements for nursing home visits, and IDPH still has not acted on those. Do you know why?
I cannot speak to IDPH. I know that here locally we are still working with a lot of our nursing homes, especially around the CMS guidelines to help them open in the different phases that were originally pushed out. We too are waiting for that guidance.
Going back to the high-risk sports, obviously, you know, can't social distance when you're playing a lot of these sports, but I mean, are there things like masking being adhered to, and is that enough to really blunt the risk?
So, you know, they do masking when they are able to. They try to distance themselves. But again, that's the challenge of a high-risk sport, and that's kind of what we have conversations with, is that when you take on that risk and acknowledge it, you know, that's part of it. And I want to kind of maybe segue as well, is that we're looking at a population that right now there's only one eligible vaccine for them. So for 16 and 17-year-olds, it is only Pfizer. We've been working with our healthcare systems, similar to how we did with the 65 and older population, to really recognize that they are going to be a great touch point for the 16 to 17-year-olds, partly because at that age range, they're going to need school physicals or immunization. So they've had contact with their healthcare provider a little bit more recently. So again, for 16 to 17-year-olds are interested in getting vaccinated and getting the Pfizer, the healthcare system will reach out to you, similar to the 65 and olders, because again, they will get the Pfizer and they're going to make a priority, recognizing that that's a very limited group that can only use that vaccine. They can't use the Johnson & Johnson, they can't have the Moderna. So again, similar to how we did before, the healthcare system is going to take lead with our 16 and 17-year-olds a lot for that. But I think, going back to this high sports, I think this is a conversation parents have to have in general, which is we're rolling into graduations and we're rolling into prom season as well as these sports. And so when we get complacent and maybe ignore best practices, you're not only putting those students at risk that some can or cannot get vaccinated, you're also, you know, again, putting those families in risk as well, that there are peers within their school district. But then it builds up, you know, it delays our ability to move into that bridge phase. It delays our ability to move forward. And so it really impacts not just you and your student or your child, but your community as a whole. So I just want to really recommend to parents that have students in the school districts, you know, we are starting to see chatter about illegal proms. We're seeing chatter about having illegal homecomings or having get-togethers for after-sport events. I understand the want to have companionship and kind of go back to that normalcy, but we are not there yet. And so it's really important to continue that compliance that we ask for, because it does give us a fighting chance.
So it sounds as if you're saying, from your medical background, you're saying that maybe they should consider dropping the rest of the sports season?
I think, from my public health background will just say that I think there are lots of guidelines and principles around those high-risk sports. And just, again, acknowledging the fact that when you take on these sports, you take on that full risk. And so it's going to be a decision between school boards and their ADs and those parents as individual students. But just really understand the full risk that you guys are putting forward when you are doing these sports. And that's why we recommend routine testing. And lots of our school districts have started that, and that's a great resource to have. And again, we have a lot of testing options in this community. Any other questions? Okay, with that, we will not have a briefing next week, but Stacy, Diana, and Gretchen will loop you guys in for when our next briefing would be. But thank you so much. And I hope everyone got vaccinated because you guys were all eligible, right? Because I almost was like, we're going to bring a nurse and just go.